Welcome to the Pain-Free Pathways podcast. On each podcast, we will explore effective natural methods to alleviate joint and muscle discomfort. From expert interviews to the latest research and practical tips, we're here to help you find relief and reclaim your active lifestyle. Let's discover the power of natural healing together on Pain-Free Pathways.
Hello, thank you for joining me today. We are going to again look for treatment options for muscle and joint pain, and we are going to be talking about physical therapy. You might be wondering, Adina, you're a physical therapist. Why are you talking about physical therapy? Well, I am amazed at how many people really don't look at physical therapy as one of the first options for dealing with muscle and joint pain. So I wanted to introduce this to some of you and maybe just inform a little bit more of the population about what it is that we do as physical therapists. Now, physical therapy has been around for quite a while. It's been around since the 1800s. And between 1920s and the 30s, polio hit the United States. And a lot of people many people contracted poliomyelitis. And physical therapists were involved with the rehabilitation of that condition. In World War I, there were many soldiers who had post-war disabilities, and physical therapists were actually helpful in addressing those different disabilities. Now, since that time, though, we have moved as a discipline out of the hospital setting and into other treatment centers. So some of the physical therapy you're going to see in a nursing home, you'll see it in an outpatient clinic, you'll see it in the school, okay? But over the years and decades, we have just kind of expanded where it is that we have operated and functioned. Physical therapists impact millions of people every year. And again, there are many people who do not understand what physical therapists do. And they don't realize many times, and I guess this is to kind of speak to my own field, many times we're not really probably acknowledged for the medical basis that we have in doing what we do and what we understand about the body. And everybody has a kind of specialty. So you're going to see physical therapists who work with solely burn patients. And that's something I can't do. But burn patients, there's physical therapists that work with patients with lymphedema, which is swelling that takes place in the legs because their lymph system is not draining like it should. There are physical therapists who work with geriatric patients on down to the other age spectrum of the pediatric patients. There are physical therapists who specialize in orthopedic problems, and there are others who specialize in neurological type conditions. And then there are therapists who really just enjoy working with athletes, and they like the challenge of that. They like being in the action of that. But then there are also therapists who might want to work with the more seasoned seniors who it can take them longer to do some of the things that they do. But all of these different parts of the population benefit from physical therapy. And almost anywhere, I could say, anywhere where you have seen someone that has experienced something that has affected them, creating a disability, creating an injury of any sort, physical therapy is going to be involved. Now, it's really, really interesting, and many people don't know this, and probably a lot of my own field, they don't know this, but there was a time when a lot of the natural ways of treating patients were done by nurses. And nurses were actually the ones that did a lot of the massage, they did water treatments, the things of that nature. And it wasn't until this whole medication orientation came in that they became part of that treatment model. So if you deal with nursing now, we're going to usually have nurses that just basically deal with medications. And so when you look at the definition of physical therapy, we go to the Oxford Dictionary, they say that if physical therapy is the treatment of disease, injury, or deformity by physical methods, such as massage, heat treatment, and exercise, rather than by drugs or surgery. And so I leaned towards going into physical therapy. I was supposed to go to medical school, but I ended up going towards therapy because of the fact that it dealt with the body in a more natural way. And I've always disagreed with pushing medications for every single problem that's out there. And I wanted to do things that cooperated with what the body did and the built-in mechanisms for healing. So you will learn it. If you hang around, you're going to understand that I am all about doing what you can do to support your body to recover. And namely, I'm going to be focusing on people who are dealing with joint and muscle problems. A good physical therapist is going to combine the understanding of your injury, your pain history, with the understanding of how the muscles and your nerves are working or not working, the normal and abnormal movements of your body. They will look at pinpointing your pain and determine what techniques are best to address it. And then looking at weak areas that require particular stabilization. Now, just like all lawyers, physicians, all school teachers and professors, I don't care what your field is that you're looking at, you still would want to find a good therapist and do your due diligence. Now, if you're dealing with chronic joint and muscle pain and you've gone to your doctor and they're kind of like just giving you some pills and that's all they've told you to do, or if they just given you an injection and that is all they told you to do, I am here to tell you, you need to take the next step and you initiate that yourself. And I'm going to talk about how you can do that. But you need to do your due diligence. From joint and muscle pain, outpatient clinics are your best settings. And if you are in a pain management program, physical therapy should be a part of that as well. Now, unfortunately, if you're someone that's in a nursing home or in a home health setting, pain is very poorly managed in those settings. There are so many constraints and restrictions in those settings. And usually they're just going to give you injections for your medication, or they might give you pills for your medication, or they might do something like an ablation where they actually block the nerve so it doesn't tell you that you hurt. And someone explained to me why that is a good idea. Well, do your due diligence. Physical therapists will do an assessment when you go see them. They will establish a plan of care. This is what we're going to do. And you're going to average 2 times per week. If you are post ACL repair or shoulder repair, something of that nature, you might end up going 3 times a week. Or if you're somebody who has actually been staying pretty active and you just need to know how to tweak a few things, you might get away with 1 time a week. But overall, physical therapists should address your pain, looking at your flexibility and looking at your strength. And I also want to tell you that you cannot compare physical therapists to physical therapists. We all specialize based upon our interests, based upon our preferences and how we intervene with the patient. And so you cannot look at what one therapist does and say that there's 2 sides to this. One, you can't say that physical therapy doesn't work for you because you did try one physical therapist. Okay, that's calling like going to a car mechanic. And just because one car mechanic messed up on your car, then you just make this global decision that, oh, I just can't take my car to a car mechanic. That's ridiculous, right? So it's the same thing with physical therapy. If you can't get the results you're looking at with one, there are others out there. Do your due diligence and understanding that even within a clinic setting, if you work with different people, they have different approaches. Some of us specialize in things like dry needling and a McKenzie approach or myofascial release or kinesio taping or strength and conditioning. And there's different things that just kind of appeal to the therapist as to why they choose to use those particular approaches. Also, you have physical therapists who are coming into the field because they were athletes themselves. They went through rehabilitation and they're like, oh, wow, this is cool. I'm going to help other people do the same. And some of them come from the, experience of maybe a family member having needed to recuperate from an injury or ailment and seeing what that physical therapy had done for them. And that piqued their interest. And others just like to help people to feel better and just want a way to be a benefit to society and those dealing with pain. But overall, my vote is for you to get to physical therapy. Now, you're probably saying, why are you telling me to go? Because, again, if you have been told, just take some pills, or you've been told, come back in about X number of weeks after I've given you this injection, and there's nothing else being offered to you, then you take the initiative to find a physical therapist. We've already talked about due diligence. You have direct access in the United States, and you don't have to have a referral, but you can start calling and then finding someone who can see you. Now, if you're Medicare, you do have direct access, but the clinic can handle this, have to find a physician who will sign on your plan of care. So that will be your responsibility to make sure you have a doctor who will sign off on orders for physical therapy. But either way, you can still initiate and you reach out to a clinic and they will take you through the process if you're a Medicare patient of what it will take for you to get started. Bottom line, physical therapy needs to be part of routine if you are suffering from chronic joint and muscle pain. So I thank you for taking the time, stopping by. Until next time.
Thank you for joining us on this episode of Pain-Free Pathways, and we hope that you found valuable insights and practical tips to help you on your journey to living a pain-free, active life. Be sure to subscribe so you never miss an episode, and if you enjoyed today's discussion, please leave us a review. Your feedback helps us to bring you the best content, and we ask that you join us next time as we continue to explore the power of natural healing and recovery. Until then, stay well, and remember, we are dedicated to restoring